children were usually potty children were usually potty trained by 18 months of age. Again, at 18 months, most of them probably couldn't totally do the whole thing for themselves, but it was much earlier than it is now, with the average time for girls in the US currently being 32 and a half months, and for boys, 35 months. And then if we look at control of stooling, it's 31.5 months for girls and 34.7 months for boys. And a lot of people think the shift happened for two reasons. One is disposable diapers. So back when we all had to clean diapers, they were wet for the child and uncomfortable, and for parents it was a lot of laundering. So it was more convenient for the parents and more comfortable for the child. So that led to part of the delay, and also there were some pushes in child development to make potty training more child focused rather than parent focused. And we're going to talk a little bit about that when we talk about the different methods. Certainly in the United States, even now, though, we know the cost of disposable diapers is very high. So when we talk about families where that's a major factor, oftentimes potty training happens at an earlier age. But the average child should at least have the basic skills to start potty training at 18 months of age, and at least developmentally. And we're going to talk about that more in a second. So when parents ask, can I start, there's pretty good consensus that the things we're going to talk about are the things a child needs to be able to do for you to be successful. So first up, can they follow simple directions? So a 1 or a 2-step command, like go sit on the potty chair, pull down your pants. Very simple commands, but if you have a child who is having some language delays, this may not be that simple. So that's the first one. Next, can they stay dry for 2 hours at a time? So you as a parent, when you're noticing how frequently you need to change their diaper, have you noticed that they're starting to go long stretches? This is a sign that they actually have some control over their bladder, because young infants will urinate very frequently, like every 30 minutes or so. But as they start to develop control over their bladder, they can start going at least 2-hour stretches. Next, can they tell you when they need to use the bathroom? And I think for a lot of kiddos, this is the challenging one, because a lot of times they're good at telling you right after they went to the potty, like, oh, I pooped in my diaper. But can they tell you when they have that urge before they go? So we're going to talk about some strategies to help them connect this concept with what it is we're asking them. Next, do they want to use the potty? So when we talk about child-focused potty training, if the kid's not motivated or at all interested, things generally don't go very well. And as parents, I know you all know that. There are very few things that toddlers have any control over, but how much they eat and peeing and pooping are pretty much, that's all they got, right? I mean, everything else the parent controls, when they do what they wear, a lot of the things throughout their day. So we have to be careful when we're potty training, because if we're asserting our will against the child, in the battle of the wills with potty training, the kid's always going to win. So that's another careful one on how you're going to approach this. And then last, just something very basic. Do they have the motor skills to take down their pants and sit on a potty? Again, for most kids, but if a child has some special needs, that may be an issue. When I say once they reach 18 months, obviously not if you're trying to potty train a 6-month-old. So there's different approaches, I'm sure, on the internet, and friends and family, we've all heard there's so many different suggestions for how to potty train your child. And when I was preparing to do this, I just always like to glance and see, well, is this the scientific literature tell us anything? And shockingly, there's been very few studies on potty training, even though it's something every human being does. It's not well studied. So I'm going to mention that before I go through with this. There is some data on two of the methods, and that's what I'm going to talk about today, and they're the most accepted. And the first is called the child-oriented approach, which is the preferred method by the American Academy of Pediatrics. This method can take anywhere from a week or two to a couple of months to totally complete. And when I say totally complete, and again, as parents, for those of us who've potty trained a child before, there's different steps, right? When they're successful going to the potty, but maybe they need a lot of prompting. So when I say complete is when the child totally independently is recognizing they need to go to the bathroom, goes there, pulls down their pants, does their business, puts themselves back together and moves on with their day. So when I say months, I do mean for the whole process for them to be totally independent. And for this method, you want to start when the child shows signs that they're ready. So we just talked about when they're showing those signs that they can do all the things we talked about, then it's time to start. If you decide to take on potty training and they're not doing all those things we just talked about, like they have no interest, they can't tell you they need to go, it's going to lead to a lot of frustration. Potty training will take longer, and sometimes you can have some increase in behavioral problems. So first off, simple introduction. So when you're starting the process, first you need to teach the child the words you're going to be using. So lots of families have different words for urinating. So some people say, we're going to go pee in the potty or tinkle, whatever word you want to use, but just make sure in your house that everybody's using the same word when you're talking to the child. If there's other caregivers, it's great if you're all using the same words. So if your child's a preschool program, if they're going to talk about what kind of words they're going to use for going potty, or you have, grandma's watching a baby, it's good if you're all using the same words so the child doesn't get confused. Also, talking about their anatomy. So, a lot, they're naked. That's going to come up, putting their bottom on the potty seat, pointing their penis down. Again, some families use different terms for body parts. As a pediatrician, I prefer people to actually, there's nothing wrong with learning the actual proper term for it. But if you as a family are going to call it something else, again, make sure everybody knows that that's what we call that body part so the children aren't confused. And then the next step would be to get a potty chair. So again, I think this is common sense. Having a kid sit on an adult-sized potty is very scary. You have to support them. So you're going to want to get either an individual potty chair or one of those seats that go on top of the toilet so that they feel comfortable. And then, next steps from there are going to be, again, child-led. Some kids may turn to it right away and sit on it, no problem. Others, you may need to go very slow, like, okay, here's the potty seat with our clothes on, we're going to sit on it, and then work towards sitting on it without clothes on. Kids are so different. Some will just sit on it right away, and others won't. Let them observe other family members using the potty. Most of them follow us in anyway, right? You never get a second alone without them following you into the bathroom. So they're watching you. This is how they figure things out. If you have a kid who's really resistant, doesn't even want to sit on the potty, you may need to put some rewards in place. So maybe when they sit on the potty, there's a fun book, or you go to the dollar store, there's some new toy that they can only play with when they sit on the potty. So try to make it a little more alluring. So next, you're going to step it up a notch. So you're going to have them sit on the potty intermittently throughout the day. And each time they sit on the potty successfully, even when they don't pee or poop on the potty, they're going to get a sticker, because that's just the first step. They're not fighting you. They're agreeing to go sit. If you want to have success or increase your success of while they're sitting, something coming out, we tend to poop about 10 to 15 minutes after we eat. So having them sit after meals 10 to 15 minutes later, you're more likely to catch their body's natural urges, and you may have some luck. Encouraging them to sit on the potty right when they wake up, before bed, and like I said, after meals. Not sitting there for long periods of time. A few minutes is sufficient. it's hard for kids who haven't totally connected, oh, this is the urge I feel and what happens. That's where I'm saying you have to almost have a little bit of luck. So the first time they're sitting and something comes out and you're like clapping, like, yeah, it's going to start to click. And a method I'm going to talk about in a second, but you could certainly use it here too. Some people recommend dolls. So I don't know if any of you have had, remember, or your own kids have one of those dolls that will pee. So, you give them a little bit of water in the bottle and the water comes out the bottom of the doll. So that can be a way for a child to understand what you're talking about. See how she's wetting and she's peeing. So it's a very concrete example of what you're talking about. Each time a child does the task that you want them to, you want to make a big deal out of it. So again, lots of yay, sticker charts, lots of praise for each step. And then once it's mastered, then you move on to the next part. So like I said, first it's just sitting there without clothes, with clothes, without clothes. And then as they're starting to have, once they've mastered that and they're going like you ask them to every 2 hours or so to sit on the potty, then you can start only rewarding them when they actually pee on the potty. But you want to make sure they've mastered a skill and you've done lots of rewards and praise for that first step before you move on to the next one. Once they're starting to stay dry, usually another motivator is getting the big girl or big boy underwear. So if you can take them out with you to go purchase them, get their favorite characters on the underwear. For a lot of kids, that can be a motivator too. So once they're starting to stay dry, getting to wear underwear for some kids can be a good motivator. Accidents are going to happen and you can talk about them with your child, but it's important not to punish the child because we don't want them to have negative associations with the potty training. And when we study how anyone learns a skill with behavioral strategies, rewards are much more motivating than punishment. So we want to stay positive, and when something when they have an accident, we talk about it, and then we move on. So they're not losing a privilege; they're just okay. Let's go change your clothes and moving forward. So as I mentioned, that process that we just described can take anywhere from a few weeks to a few months. Some people are like, no, I don't have that kind of time. I just want this over with. We're going to do it. So the other popular approach, which has been shown to be just as effective as the one I just mentioned, is it's called train in a day. Technically, it's usually 1 to 2 days, but it's train in a day. This is totally parent oriented. So you are the drill sergeant for that 24 to 48 hours. It's incredibly hands-on intensive. So you need to have a weekend where you don't have any plans and you can devote yourself to this child. So, because if there's a lot of other things going on, you're not going to be successful. Again, this method won't be successful in a child who's not showing the signs of readiness that we discussed at the beginning. But if they're showing that they're ready, this has been shown to be effective. So, as I already hinted at, this method starts with first you show them with a doll, how the doll can pee into the potty chair so that the child understands what it is you want them to do. Next, to increase the amount of opportunities for them to use the potty, you're going to give them tons and tons of water, tons and tons. You're just going to flood them. You're just going to have them constantly drinking something so that they have to pee all day long. So you're going to have your potty chair ready. I know some of my friends would have it like out in the main room, like they wouldn't even have it in the bathroom. So it was just very convenient. Whatever works for you. You're going to want them in underwear. So we don't want them in a diaper this day because we want them to have, again, a good association of when they pee, what happens. You're going to check at the beginning for dryness every 5 minutes. So if their underwear is still dry, awesome, they get a reward. Again, sticker, something small because you're going to be doing this all day, but some little token that they can get. And once they're successful, like in small increments of time, 5 minutes, you can start making it to, okay, if you can stay dry 10 minutes, you can get another sticker. When you get to 30 minutes, you're going to have them sit on the potty. If they say they want to sit on it before, awesome. If they go on it before, awesome. But at the very least, you're going to set it, set an alarm, set a timer on your phone. Every 30 minutes, they have to sit on the potty. If they have an accident, which they likely will, you're going to tell them, you know what, we're trying to stay dry, and then make them change their clothes, but no punishment. But we're going to put on dry underwear. So have a good pile of dry underwear ready for this day. And you're just going to keep moving forward like that. So again, as they master, so the stickers, that they're not going to get them for just staying dry after they've mastered that for going 30 minutes. Now it's going to be, okay, agreeing to sit on the potty every 30 minutes, then moving up to, are they, tinkling in the potty? Then you're giving stickers. And so if you can do this very intensely for 2 days, again, without a lot of distractions, this can work for a lot of kids who are ready. Now, here's some tips along the way for either of these methods. So as I mentioned, if your child has any delays, potty training is usually going to take longer. So it may take longer in that they're not showing all those signs of readiness that an average kid may have at 18 months. Your child may not have all those signs there till 3 or 4. And that's okay, but just be aware and don't push yourself or your child if they don't have the skills that they're going to need for success. And then in some rare cases where a child may be fundamentally, severely delayed, they may not be able to achieve this, but most children can. If your child has no medical problems and you're not having success after a few months of trying potty training, or at 4, they're not potty trained at all, you need to go see your doctor, because then you do need to explore whether there may be something wrong or whether there's some other parenting strategies for children who may have some other emotional developmental issues going on. Another time to see your doctor is if for 3 months in a row, they were totally dry, not at night, but during the day, not having any accidents. And then all of a sudden they start having repeated accidents. That's another sign you need to go see your doctor, because that could be a sign of a urinary tract infection or some other medical conditions. So that would be another time you need to talk to your doctor. Other tips for success: make sure everybody who cares for your child is using the same approach. Kids get confused when one person is doing it differently than others. So mom, dad, grandma, school, we all need to be using the same approach to guarantee success. And I know with child care centers, like depending on where you go, you don't have control over how they do it, but I know a lot of them are very good at telling you what their procedures are at school, so that, again, the child's getting the same language. Another tip for when not to start potty train: if there's a lot of stress going on at home, like a new baby or you're about to move, just put off the potty training. So many children regress in these situations that it's just going to put an added layer of stress on both you and your child. And also, even if you have a child who is mostly through the process of potty training and something unplanned happened, again, a move that you weren't thinking was going to happen all of a sudden does, and your child takes a few steps back, don't panic. This is very common. And to get back on track, we usually say, you kind of go back to the first part of potty training where you're rewarding like very simple things like going and sitting on the potty every 2 hours and staying dry. When kids regress like that, I say, go back to the beginning. It should go much quicker the second time, but just start over, reset, and just do the process again. As I mentioned, toddlers are learning independence. That's one of the things that they're tasked to be doing at 2 and 3. Potty training can become a power struggle. So try to keep things positive as much as you can. If you and the child are just, butting heads, everybody's really frustrated, I recommend taking a break. Take 1 to 3 months where we don't mention the potty, diapers back, put the potty chair away, it's just done. And then in a couple months, again, start the process over from square one. One of the things I can see when these power struggles go on is around stooling. So again, at 18 months, kids start to figure out that they can control when they poop And if they're afraid to sit on the potty to poop, or they've had some hard, painful poops because they were constipated, they start holding the poop in. They can hold it in a really long time. I've had kids go, 2 weeks without pooping. And the longer anyone holds in your poop, you start to stretch out your rectum. So you can go longer and longer periods of time and have really huge amounts of poop before you go. So if this is starting to happen, and I'll talk about a couple tips, but that's another time you want to reach out to your doctor on some tips on how to deal with that. Overall, totally mastering going potty, not the initial part, takes about 6 months. And when I say mastering, that's the child always recognizing that they have to go, successfully getting there on time, and being able to take care of themselves. Now, with wiping, especially with poopy times, I think a lot of us know that that may take a much longer time for them to totally clean themselves up. But most of the process will take 6 months, pardon me. Nighttime dryness is another question I get. So even after a child has mastered staying dry during the day, staying dry through the night will happen later, and it's not so much the child's will, is when they're neurologically mature. So even when a child can maintain staying dry during the day, your ability to sense that you have to go potty when you're in a deep sleep doesn't develop at the same age for everyone. So some children are able to stay dry at night at 3, and others maybe 5, 6, or 7, and that's okay. And so again, we don't want to be punishing kids because this is a developmental thing they don't have control over. Now, we've all heard of that kid who wakes up in the morning, they wet their diaper, or they wet their something right when they're waking up because they don't feel like walking to the bathroom. Not talking about that, but I'm talking about the kids who in the middle of the night, when they're sound asleep, wet the bed. And this is something that just developmentally they need some time to mature. Interestingly, kids usually do it at the same age that their parents did. So if one of the parents had an issue with bedwetting to an older age, say 7 or 8, usually their child will have it to the same age. So when I see kids in the office for bedwetting, I always say, well, they have to do a little detective work and find out who in the family has it, because there's almost always somebody, and they don't always want to admit to it. But somebody else in that family had this issue and can find out who it was and when it went away, because it's amazing. It almost always goes away at the same age. Especially like sometimes I'll have a kid that's like, mom was 12, and was still having issues. And, so this kid at 10 is so frustrated. But I think when they can hear, okay, oh, mom or dad had this and it went away at 12, there's hope for them. So I just, this is one, it's very frustrating for the parent, but not putting kids down or punishing them for nighttime wetting is just so important because it's predominantly out of their control. And that's a separate talk. There are different strategies for helping to deal with it, but mostly this is a neurologically controlled condition that kids just need time to mature. For kids who won't poop, like I said, once they've had a bad experience, some of them will start holding it in. So things you could do at home to help them make it harder to hold it in is to make their poop as soft and loose as possible. So giving them a lot of fluids, a little bit of prune juice, increasing fiber in the diet, all of those can help. If they're still willing to sit on the potty with this, again, as we mentioned earlier in the talk, 10 to 15 minutes after they've had a meal, having them sit on the potty chair for a little while. Again, that's where I tell parents, pull out the book or the game or something they only get when they're on the potty. So we're encouraging those times where their body's going to have a natural urge to poop, and have them on that potty, and then doing all the things we can to make that poop soft so it's easier to get out, harder for them to hold in. And there's plenty of other strategies your doctor can go over for you if these simple measures aren't working. So I encourage you to reach out to your doctor. So this is just a general overview. I know each individual kid has their own, everybody has their story, I think, about potty training their kids, but does anybody have any questions?
So Dr. Kudas, there was a question in the chat.
Sorry.
Jennifer was asking, I think, so she was saying her family's going through a divorce, and their 4.5-year-old keeps having accidents. So like, what would you do in that situation? Because they're not doing it on purpose.
Yeah. They're not doing it on purpose. First, if they haven't already visited their doctor, I would encourage them to do so, just to make sure there's not a urinary tract infection or something else going on. And if that's okay, then I recommend going back to the way you potty trained them before. So reminding, like setting a timer or doing something where you give them, every 2 hours that you're reminding them to go sit on the potty, and then giving them rewards and everything like that. So kind of going back to square one. Sometimes from stress or even after certain illnesses, I've had kids where they just, they can't seem to hold it as long. So, they used to be able to go a couple hours, like 4 or 5 hours without having an accident or having to go to the potty. And all of a sudden they want to go all the time. And this child maybe is just not realizing and just holding a little bit too long. So going back and figuring out the shortest interval where they won't have an accident. So if you have to remind them to go every hour so they don't accidentally have an accident, or every 2 hours, going back to that for a little while, and then gradually trying to get them to hold it for longer periods of time. Because usually, 4-year-olds can usually go longer than 2 hours. So trying to hold it a little bit longer and then putting some rewards back in place. But my biggest tip is to kind of go back a little bit to when they were younger and use some of those strategies you did for potty training.
And then just really quick, does anyone need translation that has joined? I know a couple people hopped on.
I think it's just me again. All of you.
There's a
I have a question with regard to how they deal with the whole potty experience at school. We've been back and forth with my grandson. Some days will go, other days he doesn't tell you. What is the routine at school as far as trying to encourage them to use the potty? Because Aiden's 4, he's almost 4.5, and we're still sticking him in pull-ups just because of the fact that he doesn't tell you when he needs to go. We've tried using just putting him into big boy underpants, and we've had too many accidents. He's in a routine of, we tell him to tell us when you need to go poop or whatever, and he goes off and he hides and poops, and you don't even know he's done it until the deed is done. It's frustrating because I feel like, especially when most of the day during the weekday he's at school where we can't work with it. I'm just wondering what they do there.
So I'm going to give you the limited information I know, just because I am not in the classroom, but maybe Karima, you can help me out because she has been in that classroom.
And she
I know
was
that
a teacher. So.
There are certain times of the day that they go to the bathroom, and they do also have like potty charts that they can use with stickers. I've given out books to bring home for families to use, but I don't really know much more in depth than that. So Karima, if you know anything else, please feel free to share.
Yes, I work as a teacher assistant for 5 years. Most of the time, the kids start school at 3 age. Some of them, most of them, they are body training, but some of them, they come to the school without body training. As a teacher, we have to go as a group, the whole class, 3 times, before breakfast, after breakfast, and after lunch. And during these times, the kids ask the teacher, or sometimes we find some kids is dancing in the corner or touching private spot or something. We ask, do you want to go bathroom? Yes, and if they, and also it's very important to connect between the communication between teacher and parents. If the parents is ready for the body training for their child, it's easy for us because we're gonna work together. And we give them a chat to follow in the home, and we also ask the kids after 10 minutes, do you want to go to body, do you want to go, and easy for them to learn at school, because a lot of kids go together and they will copy each other. I think, yeah, it just takes maybe 2 weeks or less than two weeks from my experience, because also the kids, oh, you go to good. It's easy for them. Even with kids special needs, I have one of the kids, it was autism, and we and the teacher just for about 3 weeks. He's fully body training, and mom was very happy. Even at home, he didn't do accident.
Should we talk to Miss Lori or Miss Tawny for some assistance with this? Because I feel like, you know, you folks are with him all week long during the day for a good chunk of his day. And it'd be nice if we could like coordinate something, because it's frustrating for him to be this age. I mean, he still has, because of his age, he will still be able to have another year of preschool. You know, whether he'll be able to be in the Head Start program or not, I don't want to be running into next year and they're going to like, well, we can't take him because he's not potty trained. So really trying to nip this in the bud.
Yeah, I think definitely, you know, connecting with his teacher, because you guys really should partner on this and be doing, like Dr. Kudas was saying, doing the same things at home as they're doing in school.
Yeah, we already need a meeting. We've been requesting a meeting because of he's not talking in the classroom and he doesn't stop talking at home. So we, you know, I don't know. We've reached out about it a couple of times and they said, yes, we need to have a meeting, and we haven't had anything happen yet. So I don't know who would be in charge of coordinating that, but.
Well, I can also reach out to the site supervisor for you today, because we're all in the same office, so I can ask her about it for you.
Yeah, if we could, because I know we've talked about this for like a couple of months, because we didn't realize that he wasn't even like talking to the teachers in the classroom. I know Miss Brooke, he goes to speech therapy and he talks up a storm with her. He talks all the time at home. So I don't know what's going on there. I know he identifies with one of the children that's autistic and is nonverbal. So is that part of it? I don't know. But I'd just like to see what we can do to get something set up and try to move forward with the potty training, the speaking. Oh,
yeah, I can definitely follow up for you.
Thank you.
Is he hard to find things that motivate him? Like I know with my son, it was really hard. Like stickers, he cared nothing for. So you know, the reward.
I mean, he likes getting stickers, but I don't know that that's going to do it. You know, he's too old. He's got a lot of different interests. To say there's any one thing that would motivate him, I'm not too sure. I really don't.
I think there is some idea. I use it with my kids. That I don't use it as a teacher, but I use it with my kids. Just in the home, take out the pull-ups or diapers. Make, for example, heavy underwear. If you scare from he feels there is no diaper, he maybe ask you to go bathroom. If he made an accident, it's okay. Tell him it's okay. But he feels this is something is not comfy.
Yeah.
Because when the kids always feel the diapers or pulls up, it means I have something, I have to poop or pee on it. But just take it out, tell him it's okay, and we give heavy, kind of heavy underwear in Walmart or yeah, and tell him it's okay. We don't need diaper anymore. We don't need pulls up. You can use this, and if you make accident, it's okay. Any people make accident, but after that he feel there is no diaper, nothing. He will. This is for my. I use it for my kids.
Yeah, we have to try that again. We did that for like 2 days in a row, and it was just one accident after another.
Yes, it is very important to be patient. You don't take it and come back, take it and come back. You have to be continue.
Yeah.
Because if you back and front, the kids will confuse and it's hard for them to follow up.
Yeah. I don't remember having this much problem with my kids, but I think I started at an earlier age with mine too. So I don't know. I was home with them all the time too. So that made a difference.
Mhm.
So, all
I
right.
think, like you said, the older they are, I think it's sometimes the motivators. Like you said, I think the simpler things that motivate a 2-year-old with a 4-year-old, it may not work as well. But if they're
Mhm.
like earning like, dots on the chart to get something a little bit better. So if it's something, one of his interests, whether it's time with just one parent, like, or grandparent doing one of his interests together, like a special carved out time that if he gets 5 dots for just agreeing to go to the bathroom, like you could work up to some. It's not the sticker itself that he's excited about, but he's working towards a concrete goal.
Yeah, I think a chart of some sort would probably work where he can go and mark it himself every time
Yeah.
he's used the bathroom would probably be better. Okay. Yeah, we need to work out a plan because you know, it's just it has to happen. That's the thing. It has to happen. So, all right. Thank you so much.
Yeah, thank you for asking.
Well, Alyssa, since I apparently our audience is small, I think I'll save the allergies for another time. If you
Okay.
need another one, and we can do that then, if that's okay.
Yeah,
Unless
that's
anybody had
fine.
a lot of questions, I'm happy to
I
do
know
it.
we're going to be running into that because we had that issue last year. So,
Oh, well, I know
that
I can keep it short. I could talk about that
yeah,
real quick.
I'm not, it's tricky because this has been Aiden's first year of preschool. So he has, now been exposed to kids for the first time. When Kelly was living with him in Delaware, they had no children around. And so this classroom is where he's been exposed to a lot. So we had him in the hospital with RSV for 5 nights in October. He was in the hospital a couple weeks ago with pneumonia. So when he just seems like he has a constant running nose, it's like, okay, what's allergy versus what's something else developing? It's tricky with him. So, but I know we have had, both of his parents have had seasonal allergies. So it's kind of hard to determine what we're looking at sometimes.
Yeah. The first year kids go to school, and then this year of all years seems to be the worst, I think, in anyone's imagination for getting sick. But as spring comes, yeah, like you said, parents are going to be like, oh, are they sick again? Or is this allergy? So sometimes it can be hard to tell, but there are a couple clues. So if children don't develop allergies to things in the environment like grass, trees, and flowers till at least age 2. You can have allergies to things you're constantly exposed to in the home, like cats and dust, before age 2. But you have to have been exposed to something for a good season, and then the second season it can happen. So 4-year-olds that are a very classic age to be developing some seasonal allergies. Ways to help tell it from a cold. The easiest one, but it's you don't always get a fever with a cold, but if you get a fever, it's not allergies. If the runny nose lasts longer than 2 weeks, especially if it's clear, it's not like they're really gunked up and they're acting otherwise well, it's just like a constant dripping from their nose. If you're a little bit older and you're starting to see a pattern, you're like, last year this time we went through this cycle where he had 6 weeks where his nose ran all the time. So if you start to have some context, that can help. It's hard because the runny nose can look like a cold, but if they're itchy, so if they start rubbing their nose a lot, or their eyes, even if they're not saying it's itchy, you're just noticing that can be a tip off that it's allergies. The watery eyes, again, not with pus or any pink eye coming out, just watery more often and red. Those can be tip offs that it's more allergies. And some kids, the symptoms are so mild, they just, do their usual thing and it doesn't seem to bother them. But when it starts interfering with their sleep or their just activities, that's time to try something. There is allergy testing that your doctor can do. So if it is, we're not sure if this kid's just had tons of colds or if there's allergies, there is testing that can be done. And sometimes parents and doctor find that very helpful when you're trying to figure out what's going on with the kid, or if it's an allergen you might be able to remove from the home. So say, again, not so much with seasonal allergies, but a kid who's just had a runny nose for months, you find out they're allergic to the cat and you're willing to get rid of the cat, problem solved. So sometimes it's really helpful to do some testing to know specifically what your child is allergic to. If they have like hay fever where they get allergy symptoms for, you know, a few weeks to like 2 months every spring, I don't necessarily find allergy testing that helpful, because we kind of have our answer once we have a pattern, like, oh, it started when the beautiful tree started blooming, and, you know, and goes away in early summer. So there's so many things over the counter now that parents can do, that we'll talk about in a second. But other basic things, especially if it's an allergy to something outside, is when they come in from playing, have them take a shower before bed. Rinse off all that pollen. You know, if you're pretty sure they're allergic to grass, or again, pollen outside, when they come in, rinsing that off. Keeping car windows and home windows closed. If you don't have air conditioning, that's not possible. I understand that. But if there are situations where it is, not letting things blow into your house, that can be helpful, particularly the car. Like, you know, when you're out and you're driving around and you're having all that air blow on your face, that can really trigger allergies. For over-the-counter products, there are tons. Some of the main things that are recommended for children are Zyrtec, which is cetirizine, and loratadine, which is brand name Claritin. They'll help with runny nose, itchy eyes. Some kids will break out in some hives. Those medicines are helpful. Zyrtec can make some kids sleepy. So if you try that on your kid, just be aware that if they seem to be acting a little more sluggish, it's probably the Zyrtec. So I recommend parents do that at bedtime, so that hopefully by morning they're not as tired. Claritin doesn't do that as much. So, you know, if you try one, but they're a little sleepy, Claritin is the one that's least likely to make your child tired. If the child is at least 4, fluticasone, which is Flonase, is actually the medicine I prefer. It helps with, if your child is really stuffy, not just runny, the Flonase is going to work much better than any of the liquid medications. And believe it or not, it can actually help with their eye symptoms as well. So even though you're putting it in their nose, it'll help with some of the itchy eye things as well. And it has almost no side effects. So there's no risk of sedation, and it works very well. So as long as they're okay with putting something in their nose. Another tip, if you're using Flonase with a little one, sometimes they have a tendency to go, they try to snip it in and help it along, but then it goes beyond their nose and down their throat, and it tastes nasty and it burns, and they'll never want to do it for you again. So when I recommend this in the office, I always show kids, I'm like, you're going to spray it in your nose and not help it along, because all it has to do is go right inside your nose. In the spray bottle, you can show them, you know, it spurts out, you know, about this far, and that's perfect. And if I go through that, then it's not going to burn their nose and they're not going to taste it. And then it's not a big deal for most of them. Things to avoid with allergies. I think all of us know Benadryl. It's been around forever. It works really well, but it is incredibly sedating. So I don't recommend that long-term for any kid. If they're having hives, they're miserable, as an occasional one-time thing, it's fine. But there are lots of studies before we had these more modern allergy medicines like Claritin, that, you know, kids who had allergies and were being treated with Benadryl, their school performance went down, behavioral issues. So Benadryl should just be a every now and then, mostly at bedtime medicine. And it really should not be used the whole allergy season throughout the day. Another weird thing about Benadryl, even though I just said it usually makes you really tired, there are some children, especially if you give it to a younger child, like under 2, they have the opposite reaction where they turn into hyper little maniacs. They start like running around, they have all this energy. So Benadryl has a lot more side effects. Again, it works beautifully on allergies, but because of side effects, when parents tell me they're doing that, I really try to steer them towards something else. If you've been treating allergies and all of a sudden your child gets a fever, I would recommend going in to be seen, because it could be they got a virus on top of things. Or it sometimes when allergies have gone on a while, your child could get a sinus infection or an ear infection. So that's should be the trigger for you to go in and see your doctor and just make sure that nothing else is going on. Other things to keep in mind, if your child starts getting seasonal allergies, if they have asthma or eczema, they often will get flared and get worse during their allergy season. So staying on top of their allergies, helping to control those, will help keep their asthma from getting bad or their eczema. So, you know, you may be, you're like, oh, I don't think they're bothered by that runny nose. I don't really give them anything for it. That's fine. But if they have asthma or eczema, you may notice the other things start causing problems. So those are times where I tell parents that we really do have to treat the allergies, even if they haven't wanted to before. So that's a very quick primer on allergies. It can be, there's a couple other things on physical exam doctors look for to help steer us towards, is this just a cold or allergies? You know, you guys probably aren't looking inside the nose, but when we look inside the nose with allergies, it tends to be like a pale blue color. And when you have a cold, it's like a bright red. But sometimes you can have both. So it's not always a clear-cut thing. I find usually the most helpful thing is the pattern. So how long, how much itchiness is going on. And then if parents or I look back at my chart and be like, huh, every March, you know, late March, I see your child here for these symptoms, I start to see a pattern emerge. And so that can be helpful. But luckily there's, you know, even without seeing your doctor, parents don't want a copay or a visit to the doctor. There's lots of safe things to try over the counter that are out there. Any other?
I was about to say the same thing. If there's any questions.
Well, thank you, Alyssa.
Yeah. Well, yeah. Thank you, Dr. Kudez, for joining. I appreciate
Thank
it.
you, Dr. Kudez. I don't know if you remember me at the Mennonite Church. Wow, nice to see you again here.
Nice to see you.
Thank you.
And thank you to all the parents that joined. I'm going to send the recording out to everybody to watch if they weren't able to join. So
Thank you, Alyssa.
yeah, thank you, everybody.